Good morning, everyone. Welcome to What to Know Wednesday with Indiana Ship. I'm Susan and glad to be with you. And I'm also glad to be joined by my co-hostess, Megan. Good morning,
Morning,
Megan.
Susan. Morning. Morning,
Well,
Facebook.
yeah, today's session is Ask the Expert. And here you are, looking at two of them. Megan has many, many years as a ship counselor, as do I.
Yes.
Um, so I am going to open it up for questions and remind folks, go ahead and chat them in. Megan is going to be
hmm
watching our Facebook page for all the questions. But um, and I've had a couple asked of me to address today, but I also just went to our ship Facebook page and found a question from someone who posted. And so I think I'm just going to start off with that one, Megan, if that's okay with you.
That's perfect.
Okay, so here's the question that was posed on our page. I'd like to apply for ship assistance. Are the income limits restricted to only my income? I'm 65. Does anyone, what does ship consider when they consider income to evaluate? So clear, clear that up for this poster, will you please, Megan?
I sure will. And I'm glad that you thought to ask that because that's the question I told you before we went on Facebook that I wanted to ask, but I forgot. So we're the perfect pair, Susan.
Mhm.
So I want to apply for SHIP. So SHIP is not something you apply for. And I've had other clients ask me this over the years or call me and said, I've applied for SHIP and I haven't heard back yet. So SHIP is somewhere that you can go to ask your Medicare questions, review plans. Think of us as what you would do if you go to an insurance agent, but we're not an insurance agent. We're free and impartial. So, what we can help you apply for is assistance programs like Medicare Savings Program, which is a form of Medicaid, extra help through Social Security that helps with medication costs, and Hoosier RX. So, that's what we help you apply for, but you're not applying to be with SHIP. Anything to add to that, Susan?
No, it's just such a good question because when we're out at community events,
Mm-hmm.
we of course have our tablecloth and all of our brochures and
Mm-hmm.
signage, and people see that. And our tagline for our logo is Navigating Medicare.
Mm-hmm.
But what our name is the State Health Insurance Assistance Program. So that really leads people to believe that it's a program that
Exactly.
helps with Medicare. And that's true. We do help with Medicare,
Mm-hmm.
but it's not a financial assistance, it's information. It's an
Exactly.
information program. So,
Yep. We
yeah,
help everyone with Medicare or a caregiver that's helping someone with Medicare. So there's, like Susan said, there's no income or resource limit for a program. Um, there would be if we help you apply for Medicaid or extra help, but not for Medicare.
right. When we're out at events, Megan, what other kinds of questions are you frequently asked?
Well, every once in a while, I will. Well, it's not so much a question, but it's a comment. But when I'm doing presentations and I'm talking about your different parts of Medicare, every once in a while, I'll talk about needing to have a drug plan, a Part D or an Advantage plan with drug coverage. And I'll get one or two people in those presentations and they go, well, I don't have a drug plan. And they've been on Medicare 15, 20, 25 years. Um, and they always have an adult child with them. And their adult child knows that they need a drug plan. So they're looking at the parent and I'm looking at the parent and we're like, well, we need to talk about that. So that's one thing I see frequently, and usually it's because they were they started Medicare before 2006. And 2006 is when it became a requirement to have drug coverage through Medicare or other creditable coverage. And they they just didn't get it because they either were not on medications, they didn't know about it, or they're on generics and they can afford paying out of pocket. So that's one thing that I get fairly regularly.
Yeah. Something I get, especially if I have a table at a community
Mm-hmm.
event, is besides what is SHIP and how do I apply for it, is how do I make those people stop calling, texting,
Yes.
emailing, and
Mm-hmm.
mailing? And I just remind folks that um, those are insurance companies or insurance agents or broker houses that are trying to give you information in hopes of receiving your business.
Mm-hmm.
So, the way to reduce that, I don't think it'll ever stop, but the way to reduce that is to, unfortunately, in this day and age, not answer your phone. Every time you pick up the phone in response to a solicitation call, whether
Mm-hmm.
it's about insurance or windows or a new roof or a
Mm-hmm.
free vacation you've won
Mm-hmm.
somewhere, that triggers your name and contact information to be sold at a higher rate because then these companies know that you're a person who answers their phone. And then if you're a person who just likes to play with them and lead them along or, treat them poorly or something, and the longer you're interacting with somebody on the phone, the more that your name, number, contact information is sold for, and the more frequently those calls are going to occur. So, in this day and age, sad to say, if you want to reduce the number
Mm-hmm.
of solicitation calls, don't answer your phone. And
Exactly.
then always remember that the federal government is not going to call you on the phone or
Mm-hmm.
send you an email unless it's in a direct response to an
Mm-hmm.
inquiry that you've made recently. So
Mm-hmm.
anybody calling you or emailing you or sending you, well, sometimes sending you stuff, they do use the U.S. Postal Service.
Mm-hmm.
But you know, IRS doesn't call you, Social Security doesn't call you,
Nope.
Medicare doesn't call you.
Nope.
So
Yep.
just be careful, guard your information, like we
Mm-hmm.
always say, and know that if you're talking to a ship counselor, we prioritize confidentiality at the top of the list. And so the information that you share with us is
Mm-hmm.
only as needed and it would always remain confidential.
Yep. Yep. I had one wife call me because we were playing phone tag to schedule her husband's ship appointment. And she called me, left me a message, and said, "Did you talk to my husband today? Because he gave out his Medicare number to someone." Well, I called her right back and I said, "Nope, I didn't talk to him." "Well, do you have any ship counselors that would call from India?" "No, no. Let's schedule your appointment while we're talking, and then you're going to hang up and call Medicare and report his number compromised." She's like, "Okay, okay." She's like, he kind of caught on when the guy asked him for his credit card number, and he hung up at that point. Well, that's good. That's good. Um, Now we do have a couple questions in the chat box, but before we do that, Susan, if you get a call from someone you don't know and they ask if you're Susan Spilly, what do you say?
Well, I don't answer calls from people I don't know, first of
Let's say
all.
you do.
Okay, see, I have a weak moment. I'm expecting a call and something slips in.
Mhm, mhm.
Uh, no, I do not say, oh yeah, who is this? Nope, I do not.
What do you say?
Um, I usually hang up. If you want to
Well,
be
that's a
honest.
response too. That's a response too.
Or
I
I
will,
just say, well, who's calling?
that's a good one.
Yeah.
Speaking is another good one. Why don't you say yes? This is Susan Spilly. Yeah.
Well, I have heard that your yes response can be
Hmm.
recorded and used it for, nefarious purposes.
Hmm.
That's what I've heard. I don't know if that's a fact, but that's certainly what I've heard. But it's just so easy. We're just so in the habit of responding in the affirmative.
Hmm.
That's a hard habit to break,
Yep.
which
Yep.
means don't answer your phone, listen to your voicemail, and call them back if you want to.
Yep. I always screen my calls. All right, so we've got a couple questions in the chat box. Thank you, ladies. First one is from Janine. Good morning, Janine. She says her 72nd, sorry, birthday is tomorrow. Do I qualify for change in my Plan G Medigap? Susan, what do you say?
Yes. Yes, Janine, you do. And that qualifying thing is called a guaranteed issue of a G plan because that's the one you have, perhaps with another company, and it could be for a much cheaper premium. Now, this is something new here in Indiana. If you're listening from another state, each state makes its own rules about when a Medigap plan is sold with a guaranteed issue. But it's called, well, we're calling it the birthday rule. Technically, it's House Enrolled Act 1226, but we like the birthday rule better.
Mhm.
And what the birthday rule says is that for 30 days before your birthday and 30 days after your birthday, you have that guaranteed issue of a supplement plan like the one you currently hold. And they cannot look at your health history or your current conditions.
Mhm.
And this is something that is, it's so brand new that many people who aren't lucky enough to have a birthday mid year and are informed about it, but you can do it once a year, and with the current legislation that's on the books. And so we help people all the time look at other options because we have a tool right on our website where you can look at different companies' plans and they will tell you how much they're going to cost you. There's also a way for you to delve into some historical and projected information right on our website. Um, and any ship counselor is happy to do that for you. We are going to have a Facebook Live, and I'm going to demonstrate how you can do it yourself. I mean, it takes like 2 minutes. It's super easy, super quick. It's just only a few clicks to have the world of information at your fingertips. And then, of course, it's up to you to make that contact with the new insurance company and buy the plan. But here's one thing that we always tell people about insurance: never give up what you have until you have your new policy signed and sealed,
Yep.
because you don't want to be without that extra insurance. So, Janine, I hope that answers your question. I hope you've reached out to a ship counselor or you've visited our website and found the information and can save some money. People are saving hundreds
Yep.
of dollars a month,
Yep.
including a couple of our colleagues at
Yep.
SHIP.
Exactly. Exactly. It's very exciting. Thank you, Susan, for a wonderful response. So now we have Lana. Good morning, Lana. Lana wants to know where she can find info on income guidelines, and is it based on both incomes if married? So, Lana, we're going to assume you're talking about the assistance programs. We help with the Medicare savings, which is a form of Medicaid, extra help, because again, SHIP doesn't have income guidelines or resource limits. It is based on you and your spouse. So if you're legally married and living with your spouse, it's going to look at both incomes, both of your resources. If you are married but you're separated and you don't live with your spouse, then it would just count your income. It wouldn't count your spouse's income. And as far as where you can find that info, Susan, would you like to let her know how she can get a hold of a ship counselor or an enrollment center?
Absolutely. You can visit our website And we have this handy little map that you can hover over, and it has a bunch of different dots where centers are that can give you very specific information, and you can ask your questions in a confidential way and then be connected to them. And then if you need help with those applications, both of which are very simple, but
Mhm.
sometimes it's a little nerve wracking to fill out a government application, then that person at that enrollment center would be happy to help you complete that application. And they do look at, both programs look at income, they look at assets, but it's important to remember that assets are not the house you live in, or one car that you drive, or your personal possessions. They are things that are easily converted to cash. So it's money in the bank, it's certificates of deposit, it's um, stocks and
Mhm.
bonds and IRAs and
Mhm.
401ks. Now, there are some types of those investment accounts, if they're annuitized, that they're not counted as an asset. But by and large, most of us don't have annuitized um, retirement savings. So, but a SHIP counselor or an enrollment center staff person can help you flesh all that out and see if you might qualify. The savings can be thousands and thousands of dollars a year. So
Yep.
I really thank you for that question. So we can delve just a little bit more into those assistance programs. Lana.
Thank you, Susan. I just had a question texted in, kind of bouncing off of that, from Linda. And Linda has heard about something called an estate recovery with Medicaid. Um, can you explain briefly, Susan, what it is and if Medicare Savings Program has the state recovery, or is it just with full Medicaid?
Right. That's a good question. And I do know, especially having been a social worker for 47 years, um, that people are concerned about mostly their home. Um, they don't, they want to leave their home to their heirs, children or so for grandchildren, because that's the asset that's most of the time, their biggest asset and something that they've paid for years and years and years. And so they're concerned if they get any kind of Medicaid help from the state and federal government that they're going to come and take their house. Well, I will say that is true for almost all forms of Medicaid, with the exception of the Medicare Savings Program. And remember, because it saves people money who are on Medicare, it has different guidelines and some different rules than traditional Medicaid. So there is no estate recovery if you receive benefits from the Medicare Savings Program. If people don't believe us, we have the official bulletin from the Centers for Medicare and Medicaid Services. And this has been the case since 2010 because we were seeing so many barriers to people applying for this very needed assistance that the federal government decided to make some laws and rules to apply to all states. And not having a state recovery was one barrier, was a new rule, and it just erased that barrier because I know you've met, Megan, and most
Mhm.
people have, who are in the helping profession, people
Mhm.
who say, I'm not applying for that
Yep,
because I don't want them to take my house. Now,
exactly.
it is true that other forms of Medicaid do have some estate recovery, which means estate recovery basically is when you die, the state can put a lien on your estate and recover the money that it's spent on the assistance they've provided to you. But again, no estate recovery with the Medicare Savings Program.
That's wonderful. Well, I don't have any other questions at the moment. Susan, do you have any that have come in?
Well, let's talk again about some common questions that we get
Okay,
as SHIP
yeah.
counselors.
Hmm.
I think sometimes people are afraid to ask really basic
Yeah.
questions. Um, so here's one I get all the time. Do I have to sign up for Medicare?
Ooh, yep, yep. That's a good one.
And your response?
Oh, Susan was asking me. It depends. depends. If you have something that we call creditable coverage, which means it's as good as or better than Medicare, generally that's your employer insurance. It might also be retiree insurance, but it's generally your employer. You can delay your Medicare till you are no longer on that insurance. And there's some rules around that and guidelines as far as when your due date on when you have to get Medicare, when you lose that employer insurance. It's 8 months for your Part A and Part B. And if it's creditable employer insurance, you can delay your Part B penalty free. You do not have to tell Social Security ahead of time. That's a common question I get. Well, don't I have to tell Social Security first that I'm doing this? No, you'll do that on the back end. There's a document your employer will complete, which is your proof basically that you had creditable employer coverage. You can also delay your Part A until you lose that insurance, unless you get Social Security income. When you start drawing Social Security, either income, retirement, disability, you do have to get Part A. Susan, anything else I missed?
No, that was a pretty complete
Okay,
answer.
thank
You
you.
know, a lot of our answers are, it depends. And
Yes.
that is when a one-on-one session with a SHIP
Mhm.
counselor is very helpful.
Yes.
So even when we're out doing public presentations, we do make it very clear, or whether we're doing, especially Medicare basics on our
Mhm.
webinars quarterly, we make sure that people understand that this is an overview. We
Mhm.
don't know people's particulars, and that's what you can discuss with your SHIP counselor. Um, because there could be some quirky little thing in your situation that
Mhm.
would skew the information that we provide. So this is overview stuff.
Mhm.
Talk to a SHIP counselor.
Mhm.
Um, and another common question is, how do I find one of those? And all you have to do is call us. Yes, you can
Yes.
visit our website and hover
Mhm.
over the map with all the dots, but you could just give us a call, and Megan will post that
Yes.
in our chat. And it's, if you follow us on Facebook, you can also ask us questions there. But if it's a real personal kind of question, just give us a buzz, and we will connect you with your local counselor. We have about 100 SHIP sites and about 400 counselors in the
Yep.
state of Indiana that would love to talk to you and help you
Mhm.
clear up.
Mhm. Mhm. And kind of bouncing off of that, we do in-person one-on-one appointments. We also do phone appointments and virtual appointments. So through Zoom or Teams, there's been times where I'm on the phone with a client and then I have their daughter in a different state on Zoom, or the client's in person with me and a caregiver or other supportive person is on Zoom so they can be part of the appointment and hear what we're saying.
Right. We
Yep.
try to make it very accessible to folks.
Yes. Yep. Yep. Hmm. Susan, another common question I get um, when frequently when I do Medicare bingo and we talk about mammograms or colonoscopies. And I say, well, these are preventative services, you don't have a copay. And I will always have one person in that bingo that says, I had a mammogram and I had a copay. Susan, why would that person have had a copay?
Right. Well, they may have a copay, or they may have the 20% coinsurance applied if they didn't have any other backup insurance. And that is because sometimes if you go in for a procedure, a screening procedure, and it turns into a treatment, then it's not preventive screening. So it comes under your treatment. Now, most of that stuff is done outpatient these days, and outpatient services come under Part B of Medicare. And there is that $283 deductible. So people may be knocking off that deductible after something like that happens. But here's the thing, when that comes up at your presentations, your Medicare bingos, or whatever they may be, you know, don't you want to know, isn't it worth the money? Because that's
Mhm.
why there are
Mhm.
so many preventive services
Yep.
available. And those have been available, most of them, since 2010 when the Affordable Care Act came into
Mhm.
being. Because the thrust of that is for us to get the preventive services that we need, to get
Mhm.
the treatment while problems are small,
Mhm.
because we know it's much more expensive and extensive
Yep.
to have something treated
Mhm.
after it's been around for a while. So that is how somebody can go in for the free screening and then come out with a bill. Don't let that scare you off.
Exactly.
Doesn't always happen, but it
Mhm.
does. It can sometimes for sure.
Mhm. Yeah. One of the common reasons that I see is it's actually not a preventative screening. They have a lump, they go to their doctor, doctor feels that lump too, orders the mammogram. That's not a preventative mammogram at that point because you're having signs or symptoms, and it's a diagnostic mammogram. That would be the same concept for colonoscopy as well. So that's one that I frequently see as well. It's
Right.
not preventative, it's diagnostic.
Right. So you know that going in for
Yep.
sure. Yeah.
Yep.
Very
Yes.
good.
Or
Very good
should
to know.
know.
Yeah.
Yes. Hmm.
That's probably the more common
Yeah.
occurrence, I would
Hmm.
imagine.
Yeah.
Yeah,
Yeah.
absolutely. Okay,
Yeah.
so I just got a text.
Okay.
Judy wants to know, what is Medicare bingo?
Oh,
So
I
tell us
love
about
it.
Medicare bingo and how people can play it.
Ooh, maybe we'll get some scheduled from this, Susan.
Right.
So Medicare Bingo is a fun way to learn about Medicare. Susan actually created this, correct? Kinda.
Well, it
Or
was
did you steal
probably
it?
somebody somewhere in the country probably had it, but yes, I did make the bingo cards and wrote the script and
Okay.
so on.
So we have bingo cards, and we have different words on the cards like Part A, Part B, Medicare Savings Program, colonoscopies. And we call out one of the words, you find it on your bingo card, you scratch it off, and then we talk about that. We educate you while we're playing a fun game. It's a coverall, so you have to get the whole sheet, and you're learning about Medicare as we do it. So we do these with church groups, senior centers, pretty much anyone, nutrition sites, I've done them at. So if you want to talk to us about a Medicare bingo, give us a call, 1-800-452-4800, and the call center will get you connected with a volunteer supervisor or a local site to discuss a Medicare bingo. We also did, well, Susan did, during COVID, parking lot Medicare bingo.
Yes, and there's photographic evidence of that. It was a lot of fun. People had a good time with that.
Get
I
out
guess
your
we were
lawn
so
chair.
starved for entertainment. Everybody came to parking lot bingo a couple of times. Um, right. And, we do all kinds of presentations, whether
We
there's
do.
something fun but informative where you actually win prizes, was Medicare bingo.
Mhm.
I've done one most recently at a library.
Oh, yeah,
Yeah.
that'd be a good one.
Mhm.
Hmm.
Um,
Hmm.
we also do presentations of all kinds. You've
Hmm.
probably seen some of those on our Facebook page, alerts. But we list all of our events and where we're going and where we'll be, and if the event is open to the public. So check out our website, or you can always call. And remember, if you want us to come and speak to your groups,
Yep.
we're absolutely happy to do that.
Yep. Yep. I actually have a presentation right after this down the road at the senior center on Medicare enrollment periods.
Oh, all
Mhm.
right, very good.
So Lana has another question for us. Thank you, Lana. Her question is, so if I start taking Social Security at 62, when I turn 65, I will not have to call Medicare. They will send me info.
And I guess that's one of the benefits, besides the money, of taking Medicare or Social Security before your age 65 or your full retirement date. Of course, you do take a reduced benefit the rest of your life should you do that. But for many people, that's the option that they choose. So, yes, if you are receiving Social Security benefits, whether it's income through retirement, SSRI, Social Security Retirement Income, or SSDI, Social Security Disability Income, then you're automatically signed up for Medicare and you will receive in the mail your Medicare card, and you get a little booklet that explains things. It's the red, white, and blue paper cardstock card, and it has your effective dates for both parts A and B and that Medicare number. Now, it also has something that says if you do not want Part B of Medicare, for which you have to pay a monthly premium, sign here and mail this back. And so many times people do not want Part B because they have other insurance coverage that they don't intend on giving up, and it's creditable or creditable. So it's as good or better than Medicare. So a lot of times people will want Part A because it's premium free, but they don't want Part B until they retire and lose their creditable coverage. So that's always an option. And again, we got to open our mail. We got to read our mail. And if you do not understand something about your mail, if it regards insurance, health insurance, Medicare, so on, give us a call at SHIP and we'll help you try to help you understand what it means and what to do. Good question,
It
Lana.
was. Thank you, Lana. And since we've talked about some of the presentations we do a presentation on Medicare mail, what to keep and what to toss.
Absolutely. I have
Yep.
one of those coming up early this fall.
hmm Yeah, that's always a good one.
Yep. And we'll even help you sort through your mail.
hmm
Bring your junk mail or what you think might
hmm
be junk mail, and we'll help you sort through
Yep.
it.
Yep. I have a few clients that do that. Every month and a half, they call me and say, I got a bag of mail for you. All right, let's meet up. Let's go through this. And I say, okay, here's your keep. I'll throw this out or
Shred.
shred it. Yeah.
Hmm. Yeah,
Because you do not want to most of that, you don't want to pitch in the trash. You do want to shred it, especially if it has personal information.
right. Well, it is just after 10:30, so if we don't have other questions that have been chatted in or texted in to us, then I think we can conclude for this Ask the Expert stage. We
I
hope
agree.
folks have learned a little something, and we really appreciate everybody that's viewed us, watched the session today. But remember, even if you're watching it as a recorded session on our YouTube channel or on our Facebook page, you can still ask us questions and we'll still answer them. So we monitor that. So write us a question and we will respond to you.
We sure will. All right. Well, thank you, everyone. We will be back on Monday, July the 13th, to meet one of our newest staff members at SHIP, our volunteer supervisor for the Southwest, Kim Wilkinson, correct? Okay. So tune in at 10 o'clock next Wednesday to meet Kim. We're super excited to have her part of the team and to introduce her to everyone. That's Monday. So everyone have a great week and we will see you Monday.